Okay, so I'm here with Ron, and Ron has come all the way from Washington, D.C. to see us today. Ron, when did you start losing your hair?
Probably around 25-ish. It started to go on the top.
Okay.
And then probably around 30 is when it started receding in the front.
Okay.
A lot more, at least noticeable.
Okay, and does hair loss run in your family?
Yes.
Okay, who in your family has hair loss?
My dad. He has no hair here and no hair up here.
Okay.
So, and he's been that way since.
Okay.
Forever.
Does he know you're doing the procedure?
Yeah, he does.
Okay, all right. Awesome, man. How did you find Natural Transplants? Tell us about your research.
Online, watched a lot of YouTube videos. This led me to your YouTube channel, and then I went on the web page, and then there was linked to some blogs also, and kind of pretty. So
videos like this, actually. Yeah. So, well, thank you for paying it forward and helping people out. Okay, what are you hoping to accomplish today? What's your goals?
Definitely more coverage. Bring my hairline forward, and obviously in the back of my hair is
in the crown.
In the crown area.
Okay. The one that bothers you. Okay, so we're going to draw out your whole hairline and the game plan for today. How does hair loss affect you? Does it affect you in any way? I mean, you seem like a pretty confident guy, but obviously it bothers you enough to get on a plane and come here.
Right. Yeah. Definitely. It definitely bothers me. And when you get a haircut, obviously, and you see it's just thinner and thinner, and you'll in the back you don't necessarily see it all the time, but when you do see it, you're just like, okay, it's getting really bad.
Well, we're going to fix that today. Thank you again for letting us follow you, and we're going to be doing some more videos throughout the process today. Alright, so I'm here with Ron, and at this stage in the procedure, we've drawn out Ron's hairline, discussed it in detail, and gone over the game plan for today. So I just want to show you, and I'll put some pictures on there of his new hairline. And again, I know we're drawing a straight line, but we're never going to be a straight line. It's going to be to the bottom and top, staggered up and down on that line. We never want to create any patterns. So what we're going to be doing is filling in all of this. And what we've decided to do, because his central portion is so good, and by central portion I mean everything behind this area, we're going to jam pack full. The central portion that he has is still pretty good, so we're going to keep that and basically then stop and do his crown. And you can see the crown area is probably his second weakest area, so we're going to really hit that hard. And if there's anything left over, we'll try to connect the dots, but really this is what we call the bang for the buck procedure. He's going to get his hardest hit areas done first and prioritize those first. So, and his genetic pattern with his dad ended up keeping that central portion, so it makes me feel a lot better. So, in any case, Ron, are you nervous? I guess everyone's, no? Not even nervous. Excellent, man. Well, thanks again, and we're gonna actually shave his head now, and again, it's never mandatory that somebody shaves their head, but there's a lot of advantages to doing it. More importantly is just keeping those follicles in. There's nothing that's gonna get caught when he's washing his hair. So thanks again, Ron, for letting us shave, and we'll be checking in on you then. Okay, I'm here with Ron. At this point in the procedure, the strip's been taken out. He's all sewn up in the back. All the little slit sites have been made on the top. And Ron, how's your day going so far?
Good. It's been easy.
Yeah. Any pain at all right now whatsoever? Nope. Zero. We've been watching some movies, and it's been a really easy day. Other than the anesthesia, just a couple little pricks in the beginning. I'm going to show you what we've done. So in Ron's case, as you remember, we chose to basically take care of 2 out of the 3 zones, which is the frontal third, which includes hairline. And you can see how jaggedy his hairline is, and that's what you want to, you don't want any patterns. And all those little tiny holes in the front are going to be single hair grafts. Behind there, we're going to use these multiple hair grafts, which are going to basically give him all this density. And then I'm going to bring you around to the back, where we basically have just nailed his crown, and we've recreated that spiral pattern in the crown. And again, Ron has allowed us to shave. Now, he wouldn't have to, but you can see with the density, how dense packed this is, it makes it a lot easier to clean this stuff in the future. His hairline in the back, again, completely covered by his hair, the suture line. So it's really hard to see a suture line now. There's a little bit of oozing, which is normal from a suture line. It was just sewn up. So Ron, overall, your day's been good. Yeah. Thanks for letting us. Come along and for the ride. And at the very end, we'll do a little follow-up video and go from there. Okay, I'm here with Ron, and at this point we've completed the surgery, and I'm very happy to say we got just shy of 8,000 hairs for Ron, and it took about 5.5 hours. So Ron, how was your day today overall?
It was easy.
Easy?
Pain-free.
Pain-free, excellent. And you know, after the anesthesia wears off in a couple hours, he's going to have a little discomfort, a little tightness. Nothing that you can't handle with a little ibuprofen and some pain medicine if needed. He's going to be flying back tomorrow, and you know, we had all the instructions laid out for him. It's all written down. He has my cell phone number. Most important thing is he's going to sleep at a semi-upright position, 45 degrees or so, for the next 3 nights, and with an airline neck pillow. But I want to kind of zoom up here and show you what we did. So as you can see, his new hairline, nice and jaggedy, and in the frontal hairline, which is right in the front here, he's got all single hair grafts. Behind those, we transition him slowly into bigger grafts. So we've really nailed that first third. And then what we've done is come around to the crown, and you can see how jam-packed that is with grafts. Each one of these little bumps does not represent just one hair. It's anywhere from 4 to 8 hairs, each one of these. So this is going to be tremendous. Thanks again, Ron, for letting us shave your head. And now we're looking forward to your results. Again, nothing's going to grow for about 3 to 4 months on average, and then it grows at ½ inch a month. Final result at 1 year. But thanks again, Ron. Anything you would say to anybody that's nervous about getting a transplant? Or
I mean, it was easy.
Yeah.
I mean, pain-free. It was
awesome.
It went by really fast.
We watched a couple movies. It was no problem at all. Excellent. All right, man. Thanks a lot. Thanks again, Ron. Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.